Hello, Kenisha. I'm glad to have you here today so I can talk to you about what is diabetes, so I can tell you everything about diabetes. So, diabetes describes a group of metabolism disease in which a person has high blood glucose. So, either because insulin production is inadequate, and then or because the body cell do not respond properly to insulin or both. So, patients with high blood sugar will typically experience polyuria. So, that is defined as frequent urination. They will become increased thirsty and hungry. So the most common type of diabetes are type 1 or diabetes mellitus, type 2 or insulin resistant, and the type 3 is going to be the gestational diabetes mellitus, occur during some pregnancy. So all type of diabetes have this similar thing, is just too much glucose, too much sugar in the blood. Yeah. So this is because the body is unable to remove glucose from the blood and deliver it to the cell in the body. So the cell use glucose as a source of energy in order to stay alive. So but the reason why the body cannot use glucose from the blood are different for the type 1 and type 2 diabetes. Okay. Since now we have take a look at the type of diabetes and the symptom. So I would like to take a look on how to achieve glucose control in the blood. Monitoring your blood glucose allow you to make decisions about your diabetes management, and then this is something to keep in mind. If your blood glucose levels swing too high or too low during the course of the day, you could develop some serious problem. So some of these problems can be risky in the short term and result in a life-threatening crisis. For example, if your blood glucose level drop too low and you are not sure, you could become unconscious, yeah. And then also can improving your diet, and doing more exercise can really prevent diabetes. Yes, it definitely can. So exercise, some people are overweight, or obese, they get discouraged because they think they will need to wear some of these ugly spending outfit and be embarrassed or at the gym for hours in order to get the benefit of exercise. So the diabetes prevention program show that if you can just make sure you get at least 30 minutes of moderate exercise 5 days out of 7, and keep this up for at least 3 years, then you will reduce your risk of getting diabetes by a lot. So regular exercise like this will also reduce your risk of heart disease, high blood pressure, and depression, any type of depression. So there's a lot of benefit by exercising. So what can you do to prevent your kid to forget diabetes? You just have to advise them to control their lifetime, their lifestyle, their eating lifestyle. So they really need to make sure about what they eat. They need to know what they eat. So they need to make sure to don't consume too much sugar or too much grease, because most of the time, most of the food we're eating goes in your body and change to glucose. So you really need to be careful about what you're eating. Yeah. So okay. Now, how to avoid hypoglycemia? So the best way to avoid low blood sugar is to maintain an awareness of your diabetes. So don't obsess about it. So, but knowledge is a companion who refuses to be left behind, because people who frequently suffer from hypoglycemia are often the one who pretend they do not have diabetes. So this lack of management doesn't work, and they often end up with a reminder of their condition. So you are more likely to have low blood sugar in a certain situation. So if you have been active daily or meal or eating lightly. So and then now let's see the danger of diabetes. So if the diabetes is not well controlled, diabetes can put you at risk for a most complication that can affect nearly every organ in the body. So they include the heart, the eye, the kidney, the nerve, the gum, and the teeth. So heart disease and blood vessel disease are the biggest complication that people have, with uncontrolled diabetes, and also according to the American Association, so diabetes is the primary source of death in America.
Oh wow.
Yeah. So now I'm waiting for the question. What question do you have?
Okay, I would like to know what level of sugar do doctors usually diagnose as diabetic?
Most of the time, the level of sugar the doctor diagnoses is by 126 milligram per deciliter.
Oh, wow.
Yeah.
Okay.
Mm-hmm.
And another question that I have is that
Yes.
if type 2 diabetes, if sometimes like they can produce insulin, just a little bit of insulin, is there a chance of getting rid of diabetes?
There's no change to get rid of diabetes, because when you have diabetes, this is something you have to carry with you all your life. So you just have to really make sure about what you eat, about your lifestyle, food. So just make sure you don't eat too much sugar to increase the level of glucose in your blood.
Okay, so
Yeah.
there is no chance of getting rid of
No,
diabetes.
there's no change. You just have to control your diet,
Okay.
basically. Yeah. So, thank you, Kalisha. Glad to have you here
Well,
today.
thanks for having me.
Yeah, thank you.